એટલે હવે છે ને આપણે ઝૂમ ઇવેન્ટ કરીએ છીએ, કેન્સરનો ઇવેન્ટ. સો આ આપણી જગ્યા છે, આ આપણી સ્પેસ છે. વી વોન્ટ ટુ કીપ ઇટ લાઈક અ રિયલ લાઈફ સિનારિયો. કીપ અ પેન એન્ડ પેપર હેન્ડી, કારણ કે તમને જરૂર પડશે પેન ને પેપરની. તમારો અમે એકલા નથી કરવાના, તમે ઇન્ક્લુડેડ છો વસ્તુ કરવામાં. એટલે પેન ને પેપર હેન્ડી રાખજો. તમારે ક્વેશ્ચન્સ ને આન્સર્સ તમારા અમે કોશિશ કરશું ટાઈમના પ્રમાણે કેટલા ક્વેશ્ચન ને આન્સર્સ લઈએ. અને તમારો ફીડબેક એન્ડ સજેશન વિલ બી વેરી વેલ્યુબલ. So please give us that. Put things on the chat. Any questions that you have, and if there are internet issues, then please bear that with us. So Kirit, આપણે શું કરીએ Kirit? Icebreaker કરીએ?
Yes, start with the icebreaker. You got a great icebreaker. Go for it.
Go on then. હવે it's your turn.
Is it my turn?
Well, it's your turn, meaning that ચાલો આપણે ask કરી જોઈએ. Let's ask everyone whether they can raise their hands or not.
Yes, exactly. Put your hands up. You can raise your hand either through using the chat. You know the function at the bottom on your toolbar. You should be able to say, reactions. You can do that. That'll show that you can do it. When you click it, it'll show that you can do it. Yes, well done. That's it. Yes, yes, yes. Good. Clapping. Great. You can see you can use it. Function. Fantastic. You just have to bear in mind that when you decide to put your hand down, it might take a few seconds to come down. So don't panic if it's still up there, hanging there in the screen. Okay, fabulous.
That's great.
That's great. We can, where the function is. Fantastic. Okay, and the next thing we're doing is we're going to do a short in the chat box. We just want to know a sense of where everybody is. Some of you already said where you are, so it'd be great if you could just say it's a geographical kind of poll, really. Just say in the chat box which location, just the postcode, the first 3 letters of your postcode would help. So give a sense of where you are in the chat box if you can, but don't worry if you can't.
Launch the poll.
Oh, you can launch it. There's a poll. Forgot, Masi. Go for it. Yeah, go for the poll as well.
અમે છે ને 2 વસ્તુ ટ્રાય કરીએ છીએ. આ પોલિંગ સિસ્ટમ ટ્રાય કરીએ છીએ, એટલે તમે એના જવાબ આપજો. અને જો તમે પોલિંગ ના મજા આવે ને તો just put it in the chat. Where you from? તમારી જેન્ડર શું છે ને તમારું એજ ગ્રુપ શું છે. Okay, so here we go with launching a poll. Can you see the poll?
Yes, brilliant. I can see it. Can everybody else see it? Hands up. Yeah. Good. That's working. You got 12 seconds and I'm counting. 10 seconds. There's 3 questions. Or was there 4 questions? I can't remember.
There are 3 questions.
3 questions, yeah. Right, there's 59%. Oh no, 11% have voted. Oh goodness, 20%.
Wow,
25%.
કયા ગામમાંથી વધારે છે? Come on, team side. That's where I'm from.
Let's not get too patriotic about our area now.
No, Greater Manchester.
Yeah. Well done. Brilliant. 43 seconds. Okay. Yeah, we're getting there. 24. So,
are we still getting?
I've got a question here, Madhuben Kirit Bhai. In number 2, it says, "What's your gender?"
Okay.
And in mine, it's showing up to 24, up to 25, 29.
Oh, really?
Is that what everybody's saying?
Having the same thing.
Oh, sorry. That must have been.
Yeah.
Oh,
that must mine as well.
Yeah,
must be a glitch. તો તમે ચાર્ટમાં લખી નાખો. મને તો એવી રીતના દેખાય છે કે
what's your gender? Right, I know, yeah.
Oh, gender.
Yeah, the questions.
Yeah,
ages. Sorry about that.
That's my fault. ગુજરાતી જ આવડે છે ને, ઇંગ્લિશ લખતા નથી આવડતું.
So shall we just do 2 questions?
Yeah,
Okay, તો તમારા જેન્ડરમાં તમે ચાર્ટમાં લખી નાખજો. તો હું હવે આ પોલ એન્ડ કરું છું. My apology for that. So I'm just ending the poll.
Right. Fabulous.
So shall I share the result?
Please do.
જેન્ડરમાં તો શું હવે છે ને તમને જ દેખાય આ રિઝલ્ટ મને તો દેખાય નહીં કારણ કે
Right. Well, we got a lot of people from Tameside and any other. So we're in a
Oldham,
good
Manchester.
spot, yeah.
We've got oh wow, we've got outside Manchester.
We got somebody in the US.
Welcome.
Welcome. Fabulous.
Okay, so
okay, right. We'll move on, Madhubin.
right,
to
so I'm
presentations,
just going
yeah.
to unpin. Right now, let's start today's event. First of all, we've got Kirit. You're going to introduce people.
Yeah. I'm Kirit, and I'm a development worker for Answer Cancer, and I introduce you to Dinesh Bhai. Dinesh.
Spotlight. Dinesh Bhai.
Namaste everyone. I'm from Ashton, Sri Bharati Mandal, representing Sri Bharati Mandal and Answer Cancer, obviously.
Thank you, Dinesh Bhai.
Bye. And then
We've got next. We've got. I'm not seeing everybody. Next, we need Meenakshi Ben.
yeah,
I'm here.
Yes, Meenakshi Ben. We've got Meenakshi Ben, who is from Jain, who's done a lot of work in Jain Samaj, and she is our lead Answer Cancer champion. She's not just lead Answer Cancer. I think Meenakshi Ben is a retired professor of cytology, and she's such an inspiration for me and the whole program. Thank you.
No, you are too kind.
thank you, Doc. Thank you, Masi.
Pajama pranam. Thank you.
Next we
Fantastic.
have with Krishna Ben. So we've got Suraj Ben from Oldham, and Suraj Ben and Krishna Ben. They're both. I met them last week regarding Answer Cancer champions, and found out that in Oldham they've already done a lot of work. So we are now working together from Ashton, Oldham, Manchester. So we're all together as one unit working for Answer Cancer. So thank you, Suraj Ben. I can't see Krishna Ben.
She was here.
So
There she is.
I can't pin her. I can't see her. Okay, so we will go on to our Krishna Ben. Right. Okay. So we've got Krishna Ben as well as our Answer Cancer champion. So next we have Divya, Dr. Divya Rajani.
Hi,
And-
everyone.
Divya is a GP from Manchester. And Divya, you've been a real inspiration, and she's been the life force of this event. Just casually speaking to you, this is what we've come up with. I'm really grateful to you.
Oh, it's okay. Hi, everyone.
So Divya has also, she's the first speaker. So she's also brought a cancer survivor with her. Her name is Angelique Parvez, and she will also be chatting to Divya with regards to her journey. So thank you, Divya. So shall we start with your presentation first?
Absolutely. So thank you for that. Just going to get my screen up and then I'll be able to share that with yourselves. So thank you for that really nice introduction, and it's really nice to see the Zoom conference is filling up. So thank you for everyone who is joining us today. So I'm going to be speaking to you today a little bit about some of the Can everyone see that okay? If you can, just put a thumbs up so that our host can know that you can see my shared screen. So my name is Dr. Rajani. I am a GP in Manchester. And I have a very professional relationship with the treatment of cancer. So usually the GP is the first place that a patient will go when they start experiencing symptoms. And usually the cancer journey should start really from the general practice. But I look after patients who have been already diagnosed with cancer, are receiving treatment. And also I look after patients that are unfortunately have no further treatment on offer and are now approaching the end of their life. So extremely rewarding work. Personally, also, I have been affected by cancer. So in 2019, I lost my mum to terminal cancer. So this is a charity that obviously I want to help spread the word, particularly in our community, about getting help for cancer in a timely fashion so that you can get the treatment and have a journey that is the best for you in those difficult circumstances. So what I'm going to be doing today, I'm just going to be talking to you about the problem, the barriers that we face in our community in particular. They're not exclusive to the South Asian community, but a lot of the problems that I'll be discussing are very prevalent. So I'll be talking about these barriers, and also I'll be talking about how we can make practice from today that can help ease this this journey that many of us may face during our lifetime. So when I talk about barriers in the literal sense, a barrier is anything that prevents us getting access to something. So a medical barrier is something that stops you from being diagnosed, being treated. And there are physical barriers. So my family is from East Africa, India. And in places like that, some of the physical barriers people see are sort of access to roads, and particularly for all of us at the moment, one physical barrier is the COVID-19 pandemic. Now that as a barrier, so the coronavirus is actually such a big topic. I think Kirit Uncle said that we're possibly going to be having further events to deal specifically with coronavirus. So today I'm going to focus on more the psychological and social things that are stopping us from seeing our GPs to get a diagnosis for cancer. So the problem at the moment in the community is that when you speak to people within the Asian community, they think that actually cancer isn't a condition that's very rife in our community. So diabetes, very common, high blood pressure, very common, but cancer, it's not something that's going to happen to us. But what you'll find is that cancer can occur in the South Asian community. And there are certain types of cancer that are definitely more prevalent. So Asian people, South Asian community still have a very high rate of smoking. And we also use smokeless tobacco. So you might be familiar with people chewing tobacco, sniffing tobacco, and palm as well, still very predominant in our community, even here in the UK. Also, the fact that Asian people aren't seeking cancer diagnosis means that it's not being detected early. And we know that when cancer is detected early, in most cases, it has a better outcome for people. So you can get treated. Usually that means the cancer hasn't had a chance to spread. And so all of those things are really important, that we try and get cancer detected straight away. The other thing is, as a GP, I don't want my patients being diagnosed with cancer at the last minute in the A&E department. So if any of you have ever been to A&E, just give a thumbs up. You know, it's a long wait. It's not the nicest of environments when you're getting bad news. Unfortunately, a lot of people do get bad news in A&E. But if you went to A&E with a cough because you've been ignoring it for months, and they do a chest x-ray and they see something not very nice, probably A&E is not the place you want to find that out. You probably want to speak to your known GP and get that diagnosis and get that information when you're sitting down and you've got maybe a drink in your hand, but not in the middle of the night in A&E. So that's really important that we spread this message. And finally, amongst my patients, I still see a huge stigma around discussing cancer. Nobody wants to use the C word. There's often quite a lot of shame associated with cancer. Oh, she's not well, but no one will tell you exactly what's wrong. And I think we need to break that. Okay, we need to start saying cancer out loud and feel comfortable. It's not anybody's fault. It's a disease like any other disease, and we should feel comfortable. You know, Asian people will often talk about acid reflux, their diabetes, but they won't mention cancer. And we need to stop that and break that barrier. So the first barrier, which is the most common barrier that I see in my practice, is fear. Okay, fear is very paralyzing. It stops you from taking the right action. It makes you act in different ways, and often not knowing what a diagnosis of cancer will mean for you will stop you going to see a doctor. Other people's opinions, how are you going to tell your friends? How are you going to tell the family? That stops people from actually taking action and looking after their health and seeing a doctor. Some people are afraid of needles, having a blood test, going in the scans, so the machines, MRI scans, CT scans, that can be quite scary. So they don't want to seek help. They don't want those tests. Also, South Asians in many cases live in joint families. So you're either caring for someone or you're being cared by someone. And sometimes, you know, thinking, oh gosh, if I've got cancer, how am I going to look after these people? That can often mean that carers put their needs after the needs of the people they're looking after. So that is a common reason. Sometimes, you know, if you've got an elderly parent at home or you've got young children, you might say, actually, I'm not going to see the doctor because I need to look after them first. And, you know, we need to start looking after ourselves first so that we can help other people. And finally, a topic that doesn't really get discussed in many Asian households is death and dying. It's like the elephant in the room. Okay, we all know it's going to happen. Culturally, religiously, there is a lot that's said about dying. You know, it's one of the things that is guaranteed when we're born. But how many of us have actually spoken to our loved ones about what they want to happen to them should they die, should they be dying? What do they want to happen to them? When do they want treatment to stop? Where do they want to be looked after in their final days? We don't feel comfortable. So we need to break that barrier. So how do we do that? The first thing is that we need to educate ourselves. And I'll talk to you a little bit about how best to educate yourself, because I know right now everybody is a bit of an internet doctor, and Dr. Google often has the wrong answers. So I'll talk a little bit about that in a moment. The second thing is build your support systems. So find people within your community. So it doesn't have to be family, because sometimes these discussions are hard with family. Find friends, somebody you trust. And if you're going through a cancer diagnosis, so you're in the process of being diagnosed or you have cancer, find somebody that can support you, somebody that you can talk openly with, somebody that's not going to judge you. The second thing is, sometimes it's very good to look at the big picture, you know, but with cancer, it can really feel a bit overwhelming. Thinking about next month, the month after, even a year after, it can feel quite scary. So I would say just take a small step. If the first step you need to take is go to your GP, do that. And then celebrate that you achieved that you went and you spoke to your GP, however hard it was for you. So take small steps to overcome your fear. Again, have the uncomfortable conversations. Really, this is to some of the family members that are now getting more older, I would say. Speak to them and say, look, if you became really unwell, what do you want to happen? Because we might have to make the decision for you, and we want to do what you would want to do. And finally, reach out to support services to help, again, help with that fear. So the Macmillan charity is a great cancer charity. It's nationwide. It's they're specialists and they have so many resources. They can help with emotional problems for you or the cancer sufferer. And then also your GP will have access to what is known as a palliative team. So palliative team basically just means the team that looks after you when you are approaching the end of your life or you are having a terminal diagnosis. So a diagnosis that doesn't have a cure, okay? And that can start, you can be in the palliative care team for years, okay? The next barrier, very, very common. We have everybody that agrees with this or has experience of this, please put a thumbs up in the box so we know. You have aunties, uncles, cousins, daughters, friend had cancer. And suddenly now you're getting all this information from them, okay? Well-meaning family and friends will say, oh, but this person got this treatment and this person, and they're just trying to help. But sometimes that information can be quite misleading, okay? And it can increase the fear that you might be feeling. Also, when you are diagnosed with cancer or someone you love is diagnosed with cancer, you want to go on Google. Okay, there's a reason we've been to university. There's a reason that we as doctors have experience. Google will tell you that you have cancer, even if you tell Google that you've got a sore throat. So Google isn't a good doctor. And I would say, please try to avoid going on just random searches on the internet, because the information is very, very misleading, okay? Not all of it has been verified. Anybody can write anything on the internet, and sometimes that will increase your stress and anxiety. Also, there's internet forums, so chat rooms that you can go on and speak to people. I always say that the internet has a negative bias. If somebody's had a very horrible experience, they're going to write it on the internet. If somebody has had a good experience, they're outliving their life and they've not got time to sit on the internet and write lots of stuff. So you often see that with restaurant reviews. There's great restaurants, people don't write when things are going good. When they've had a bad experience, they'll write it. So don't look on the internet if you can, only look at things that are verified. So if you are going through a cancer journey, or someone you know is going through the cancer journey, create a boundary. If somebody rings you to ask about your cancer or give you advice about your cancer, say, I don't mind speaking to you, but I don't want any advice, please. Set your boundaries so people aren't ringing to give you advice that might not actually be helpful to you. Only use websites that have been verified by health professionals. Okay, these are people with lots of experience. They've got a degree in medicine, and they will be able to give you information that is correct. So if you have a pen and paper, you might want to jot down some websites that I give to my patients. So NHS UK, great website. They have all conditions, not just cancer. You just type in the condition and they will give you some information about it. They will tell you what you need to look out for, how you can treat, and what to do if you're very unwell. Another website that I love to use is called patient.info. This is patient information that I often send to my patients. And finally, macmillan.org.uk, a very good website specifically for cancer family and also the sufferer themselves. They have a great helpline that you can ring. So if you're emotionally very stressed and you just want to speak to someone, they are absolutely fantastic. So yeah, if you need those websites, I'm sure we can email you them as well. So finally, another barrier is language. Okay. Interestingly, how many of you know that you can get an interpreter? Just pop in the chat box if you can. How many of you know that when you go to see a doctor, you have the right to an interpreter that speaks your language? Okay. So what I see in my practice is people bring well-meaning family and friends to their appointment. And I understand sometimes it's the morale, the support that you need, but using family as translators has lots of challenges. Firstly, medical words, many of them come from actually the Latin language. So they're not easy to prescribe, they're not easy to pronounce in English, let alone translate into Gujarati or Hindi or Urdu or Tamil. So putting your family in that situation is often a bit unfair because they might not be able to translate everything. Also, if you're having an intimate examination during the consultation, so they're examining your breasts or your back passage, sometimes it's not very convenient to have a family member in the room then translating that, okay? Sometimes there's lots of misinterpretations, and often well-meaning family and friends might not actually tell you what's happening because they don't want to upset their family member. So as a doctor, if I say I'm worried, that doesn't always get told to the family member. And I think it's important that the doctor is honest with you and you are honest with the doctor. And when there is a family member in between, that can sometimes be quite hard. Also, we have to remember that families are humans, and them hearing that you have cancer will have their own emotions in that consultation. So having a third party there as an interpreter can help them process what is being said to them and take away the pressure, oh, I need to translate, okay? So what is our solution to this? So please, if there's anything you learned from this today, if you don't speak English as your first language at home, you're going to need a translator. So please let your GP know what your language is and that you will need possibly a double appointment because it takes a bit longer. They can even put a note on your records to say, doesn't speak English very well, would need a translator. So in future, you don't need to always remind them. When you have an intimate examination of any of your private parts, your breasts, your back passage, you can ask for a chaperone. Okay, a chaperone is somebody who's in the room with you. They make sure that the examination goes well and you're not having any problems, and they act as some protection for you. And you can ask for somebody of the same sex. So if you're a woman, you can ask for a woman chaperone, okay? And that will hopefully help you with any embarrassment. There are lots of leaflets and guides available, but there's no point having them if you can't read English. So please ask your doctor for information in your language, okay? It's no point having all the information and you can't understand it. And finally, a big tip I would give is if you are attempting to speak to your doctor yourself and English isn't your first language, what is very helpful is at the end of your consultation by phone or face, ask your doctor, can you just summarize the main points that I have told you? And the doctor will tell you what they've understood. And that will help you see whether, what they've said has helped, they've understood what you've said and you can correct them, okay? And finally, this is a big one, and I could probably have done the whole presentation on our limiting beliefs and our cultural influences. So cancer doesn't happen in Asian people. Okay, that's a very big misconception. What we find is that, yes, we have a lower rate than the white British population, but we still have a risk. And we also know from the research that's done that the levels of depression after a cancer diagnosis are greater in the South Asian community. We know that the uptake of end-of-life services in the South Asian community are much lower than the white British population. And we also know, the research shows, that most Asian people that have been diagnosed with cancer had never known that they had the right to make an advanced care plan. And that is a plan which I've touched on earlier. If you were to become more poorly and you couldn't communicate, you can have a plan to say to the doctor, this is what I would like, and this is, I don't want to go to hospital. If I become unwell and I'm so unwell that you think I'm going to die, I don't want to go to hospital. If I'm so unwell, I don't want to go to a hospice, I want to stay at home. So it's really, really important that we take this issue seriously. Another cultural thing that you'll see, many of you will hear it, this is the will of a higher power, this is the will of destiny. Life is a careful balance between, destiny and our higher power and our own personal responsibility. If you are having bleeding from the back passage, if you are having weight loss, if you are having changes in your appetite, this can be seen as a sign for you to do something. If you were not to take any interest and just leave it all to destiny, you wouldn't be given the sign. So we have to have that careful balance. And finally, a lot of Asian people always tell me this, ignorance is bliss. If I don't know, I'll be fine. That is a coping strategy and it's not very helpful because if you pretend to ignore the symptoms that you have, they will catch up with you. And unfortunately, it may mean that your cancer will spread, and that you won't be able to get the treatment that you would have got if you had just said, you know, this is wrong, I'm going to get help earlier on. Okay, so how do we overcome these limiting beliefs? So the first thing is, when we say that Asians have a 20 to 60% less chance of getting cancer than the white population in the UK, I want to remind you that the South Asian population is now living in the UK. So they're not living in the same environment as our ancestors. Our lifestyles are much more westernized now. And we know that lifestyle can really impact your risk of cancer. So if you're now living a Western life, you will be more susceptible to these emerging cancers. So we are seeing breast cancers, female cancers more commonly now in Asian women than we were before. And I think some of that is to do with the environment, our lifestyle changes. So please, even though you might feel, oh, we're not going to get cancer, it's your responsibility to make sure that your eating, sleeping, and exercise habits are taken care of. That isn't anybody else's responsibility but yours. Also, when it comes to destiny and higher powers, maybe rethink what is in the control of destiny. So what do you not have any control of? The outcome of your cancer is not necessarily in your control. Getting help for your cancer is. Okay, so that is something I would ask you to think about this evening and really reflect on that. Finally, a lot of Asian people, when they hear that there is no cure for their cancer, they turn off. There's no cure. They go into a depression and they don't engage with their GP or their doctor. I want you to know that care is just as important as cure in cancer. It's, you know, often a very difficult journey. So if you are being told by a specialist that your cancer is terminal or your family member's cancer is terminal, that should never compromise on them receiving care. Psychological care, physical care, whether it's help managing at home, which the GP can help refer you to crisis services, whether it's physical needs such as washing themselves, taking their medications, again, the GP can signpost you. So if you have been told your condition is terminal, don't give up because care is still available. So finally, we as a community, we have a lot to do in terms of breaking the barrier, breaking the stigma, and you can start today. When somebody tells you or you hear that somebody has cancer, try and change your mindset. You know, we often pity people or, you know, think, oh gosh, you know, she does everything right and she got cancer. Let's try and change our attitude and try and empower people that we know with cancer, okay? We can educate, reflect, and continue to have events like this that you're all joining today to spread a positive message about cancer. Let's keep communicating, let's keep chatting, okay? The C word doesn't have to be something that we're scared of. It needs to be something that we discuss as freely as diabetes, reflux, hernias, all happy to talk about that. Let's talk about cancer. And please keep in touch with the Answer Cancer Service because, you know, looking at the turnout here today, we've got almost 80 people joining us this evening. You know, we will be hosting some future events. So just keep a lookout, keep educating yourself. And if you're not doing it for yourself, everything that you're hearing today might actually help you help somebody else, okay? So thank you very much. That brings me to the end of my presentation. There will be a chance for you to ask questions to myself at the end. But at the moment, what we're going to do is we're actually going to speak to another person who's actually joined us here today. Her name is Angelique Pervez. She's a member of the South Asian community and she is a cancer survivor. So I thought, based on some of the things I've discussed, I thought it would be really nice for you to speak to somebody who's been there. And she will give us an insight just into her journey, okay? So if the host could
Yes,
kind of
she's
help.
unmuted, Angelique.
Hi, Hi, Angelique, can you hear
Hi.
us?
Yes, I can. Hi.
Hello there. Okay. Hi. So, can everybody, if they just put a thumbs up if you can see Angelique okay? Perfect. Okay. So, Angelique, just going to start off by saying thank you so much for joining us today. It's incredibly brave to speak to people that you've never met about a journey that is very personal to yourself. So I'm just going to start off by just opening the floor and just letting you give us a bit of a background and tell us sort of a little bit about the cancer that you faced.
Okay, so thank you everyone for giving me this opportunity. Thank you, Dr. Rajani. I'm really grateful to be here. So thank you. My name is Angelique Parvez. I'm half Indian, half French. I lived in India most of my life till my degree and then came over to the UK. And I have two teenage sons who I'm very proud of. And I'm actually a dance and fitness instructor. I own a dance and fitness business. I own a Bollywood dance school as well. But I'm actually a university lecturer in business strategy. So very, very different areas that I work in, but dance is my passion. And I use it to help women particularly keep fit and healthy in body and mind. So that's a little bit about me.
Perfect. Okay. Angelique, if you could tell us a little bit about the type of cancer that you had and a little bit about how you picked it up.
Okay, so it was 2019, towards the end of 2019, when I discovered a lump just under my left armpit. And strangely, I don't check regularly, but that is something we should all do. But I was kind of going through a very stressful period in my life, and I was having a lot of stress and anxiety and things like that. And I could constantly feel like little bit of pain in my chest, strangely. And I kept thinking, why am I getting this regularly? It kind of became kind of very regular. And I kind of feel like it was kind of maybe God's sign or whatever. And then I started, then checking, why am I feeling this pain? Like, is it hurting here? Why is it hurting here? And then went further down and kind of felt a lump. And so that's when I kind of, had a little bit of alarm bells and I thought, oh, a lump. And then decided to go and get it checked, really. So I had breast cancer, basically.
And when you found the lump, you said, obviously, I went to go and get it checked out. What was your reason for wanting to get it checked so soon? Because there will be people listening today who, wouldn't really feel that they would be brave enough to do that. They may sit on it for a while. I've had people that have had a lump for, have seen me after having a lump for months. So what was your thinking process? Why did you want to get seen? What was your...
So I've had breast cancer in my family anyway. My aunt, so my dad's sister, had breast cancer when she was quite young. And it's kind of been at the back of my mind all through kind of my late 20s. I used to always go to my GP and say, get myself checked every few years. And I have had, actually, strangely enough, about 2 or 3 years before that, I had a lump earlier as well and got it checked, but that turned out to be just kind of some fibrous tissue. So when I had this other lump again, I thought, let me just get this checked. Obviously, I didn't expect it to be cancer. I was hoping, like before, they would say, oh, yeah, it's just another lump. But because I've had it in my family as well, and kind of I found something, so I just thought, better to get it checked. Always better to be safe than sorry. So that's what I thought, really.
Yeah. And were you scared?
I was worried when I found the lump. Yes, I was worried, but then you've got to not be too worried as well. You can't kind of always think the worst straight up. And plus, like I said, a few years ago, I had that experience already and it turned out okay. So to be honest, I wasn't too scared, but yes, I was a little worried and I thought it's better, to get it checked, really.
And then you were told that you did have cancer. And am I correct in saying you were told that you actually had cancer in both breasts?
Yes. So first they found the first one, And we didn't know about the second one till I had MRIs and things like that, because, you know, they found it in the MRI. It wasn't something that I could feel or know that was there. And luckily, because I'm lucky in that sense, so thank God, because they were both early stages, really, really early stages, I guess I had no other symptoms. And like I said, I was a fitness instructor, so I was fit in physical form completely. There was no symptoms I could have told, you know, looked out for other than that one lump that I had.
Right. Okay. And, you know, I mean, that would have been, you know, you went for one lump and then they found another one. So that would have been a double, even if it was the same, you know, it was breast still, it was still probably quite a shock. So how did you sort of find that internal strength? Because a lot of people say, I'm not strong enough to deal with cancer. I can't deal with it. How did you find that internal strength to go through? You said you had the MRI, you would have been referred. You know, where did that internal strength come from?
Okay, so initially I didn't have the internal strength at all. So like I said, I was expecting them to tell me that it was fine. In fact, strangely enough, when I went for my mammogram and ultrasound and all of those checks, which was really quick after I spoke to the GP within 2 weeks. When I had the mammogram and ultrasound and everything, everybody, even the consultant at the hospital, kept saying, it doesn't seem like cancer, don't worry about it. It seems like something else, but it's better to get it checked.
Yeah.
Because it was so early stage, I think they didn't expect it to be cancer. So when they said those things, I wasn't too worried. But when we went back to see the doctor, they called us in for an appointment, which at that point, my husband was quite worried and suspicious about it, whereas I kept thinking, oh no, it's probably okay. They've said it's fine, it should be okay, trying to probably fool myself. So when I got there and they said it was cancer, that was quite a bit of a shock. I think they were surprised as well. Their words were, we're surprised as well that it's cancer. So I think it was very early stages, which is a good thing. But yes, it was a shock. It doesn't matter what stage it is, it's always a shock to be told. And I wasn't strong. I'm the person, like Dr. Rajani says, I hate blood tests, I hate injections. I'm totally panicked for all of that. And people say to me, I mean, you know, even smear tests and all of them, I absolutely detest them. So I'm not like a strong person with all of that. But when I found out about the cancer, I was really shocked. I have to say, I'm kind of normally a strong person, but I actually had panic attacks, anxiety attacks for the first 3 days. I couldn't leave my home. My husband had to stay with me. It was very scary. I kind of just lost it in terms of anxiety, fear, worry, and all of that. How did I find the strength? Firstly, I went to my GP and I said, I need some tablets for these panic attacks. Because I thought I literally can't, it was literally day and night, you know, I couldn't see a TV program that had some scary music. I mean, everything reminded me of probably my mortality, which kind of came in front of me for the first time. And so the next day I went to the GP, got some tablets. I don't know if the tablets helped or not, but whatever. 3 days passed. And then I thought, you know what, because we had to tell our kids. And I thought, how am I going to tell my kids if I'm going to be kind of freaking out like this? And I just knew this is just ridiculous. I have to find the strength to get on. And I mean, it's here. What am I going to do? There's no escape. Where am I going to run, right? There is no escape. We have to get through this. So I just have to find my strength. So the way I did it, I just depended on God, went back to my faith, just hung on to my faith, you know, lots of prayers, family support. I looked into a lot of things like deep breathing exercises, meditation exercises, all of that just to, you know, just to calm my mind, because the mind was so anxious and worried. I had to get the mind under control, and just having my family, that was very helpful and supportive. And also, like I said, just praying, breathing, meditating, those kind of things, and kind of distraction techniques as well. But you have to take control of your mind yourself. So that's how I managed to somehow find my strength after that.
Perfect. Okay. So thank you, Angelique. That was really insightful. experience that you've shared with us. So hopefully that sort of ties in with what I've said. So you felt that you could speak to your family, so you had that support from them. You also understood that, you know, it was your fears, and you sort of took action to
Yes.
fight those fears. And, you know, there is a lot of psychological support available to people that are either being in the process of being diagnosed or that have just been diagnosed. And again, I would advise, you know, anybody viewing today to please look at the Macmillan support services. So Angelique, is there anything else that you wanted to say, or if not, we can move on
Yeah,
to our next?
no, I just want to say thank you, and just everybody, you know, the thing is we all, how do I say this, expect, we don't think about it, and you know, we just think we're here to live forever. I mean, we all have challenges in life one way or another, but it's not about hiding from it or hiding the challenge itself. I think it's about, you know, dealing with what we have and kind of finding the strength and leaning on people, getting advice. Don't just keep it to yourself. Don't hide from it. It's better to get it checked, better to get it sorted. You can't escape from things like this, so better to get it sorted in time, in a good way. And also speak to your family and friends. You know, they're there for you to help you through it as well. So you don't have to go through it alone, definitely.
Thank you so much.
You're most welcome. Thank you again.
Okay, bye-bye.
And Angelique,
Thank you. Thank
Don't
you
go-
so much, Divya and Angelique. You know, beautiful presentations. Both of you have actually, you know, provided so much information. One of the questions, you know, in the personal chat I've had is, you know, there's so much information, Divya, that you've actually provided. The whole event can be that. And there is so much information there. I think બધાને ઘણું બધું જાણવાની ઇંતજારી છે, કારણ કે તારા કોન્ટેન્ટ્સમાં એટલી બધી વસ્તુ છે which people ને ગુજરાતીમાં સમજવું છે. પણ I think આ અમારો પહેલો event છે, and we are only just learning from it. So I think the next event અમે જે આપણે દિવ્યાએ જે પ્રેઝન્ટેશન કર્યું ને એ આખું પ્રેઝન્ટેશન અમે ગુજરાતીમાં translate કરીને, because that's the question I've had. There is so much information that આપણે બધાને આ લઈ જવાનું છે. So maybe I think we'll focus on breast and breast screening and breast, and we will focus on elaborate Divya's presentation in Gujarati. And I'll support Divya to do the Gujarati bit. And I know Meenakshi Ben is really fluent in Gujarati as well. So I think between us, તમે અમને માફ કરજો, because અમારો time, અમે બહુ adventurous હતા અને અમે આટલું બધું પીરસવાની તૈયારી કરી છે. But I think didn't want to stop you both, because it was so excellent information. And for that reason, what we're going to do is Maro talk ne Dinesh Bhai no talk ami aje nahi kariye. So we're going to stop our talks today, but we will go ahead and do Meenakshi Ben next. So I'm really grateful to both of you, and thank you so much.
Thank you.
Thank you.
Dinesh Bhai, did you want to say something?
no, I think that's a good idea. We'll go Gujarati, we'll translate it to one. We will do our presentations next time round. I think that'll be
Yeah.
much better. Yeah.
Thank
Yeah.
you.
Yeah.
Thank you for that, Dinesh Bhai. So
Thank you.
I think Meenakshi Ben, let
I'm
me
here.
bring you.
Fantastic. Thank you, Divya, Dr. Divya Rajani. Thank you, Angelique Pravit. That was really wonderful what you shared. And now over to another fabulous professor, retired professor, Meenakshi Desai. She's amazing. She's going to do a presentation. I'm going to share her slides, and bear with me.
Okay.
Go for it.
Okay. Thank you. Thank you for very kind information. But this is just quickly to say that I am from Manchester and I was consultant at Christie Hospital and Manchester Royal Infirmary. I'm a lead cancer champion. Next, please. Now, હવે તમને ખબર પડશે કે મારી ઉંમર આ બધા યંગસ્ટર જેવી નથી, એટલે ટેકનોલોજી આપણને ના આવડે સરસ, એટલે મારે બદલે કિરીટ થેન્ક યુ સ્લાઇડ બતાવે છે ને હું નેક્સ્ટ કયા કરીશ. સો પ્રણામ અને કેમ છો, અને તમારી સાથે શરૂઆતમાં વાતો કરવાની બહુ મજા આવી, અને તમને થશે કે આ મારી કેન્સર વિશેની વાતમાં હું મારા બા બાપુજીનો આરતી કરતો ફોટો અને મારા સાસુ સસરાનો ફોટો કેમ મૂક્યો છે, પણ મારે એટલું જ કહેવું છે કે ખાલી 2 લીટીમાં કે જ્યારે જ્યારે એ લોકો માન્ચેસ્ટર આવ્યા ઇન્ડિયાથી, આઈ વોઝ બોર્ન એન્ડ બ્રોટ અપ ઇન અમદાવાદ, ઇન્ડિયામાં. બાકી અમદાવાદી નથી રહી, કારણ કે 40 વર્ષ અહીંયા રહીશું, પણ મને બોલતા તો બરોબર ગુજરાતી આવડે છે હજી. પણ એ લોકો આવ્યા ત્યારે અહીંના બધા મંદિરોમાં, એ વખત તો ગાંધી હોલ હતો અને બીજા મંદિર હતા બી નહીં, પણ ગાંધી હોલ ને પછી જ્યારે આવ્યા ત્યારે, અને મારું રૂટ્સ જૈન છે તો જૈન સમાજને બધાએ એમને એટલો આવકાર ને એટલી સરસ રીતે રાખ્યા હતા કે એમના છેલ્લા શ્વાસ સુધી એમણે કીધું કે ઇવન અમદાવાદ કે પછી અમેરિકામાં છોકરાઓ છે એના કરતા માન્ચેસ્ટરમાં માણસો એટલા સરસ છે, એટલા આવકાર આપે છે અને એટલા ઉમળકાવાળા છે. તો છેલ્લા એમના શ્વાસ સુધી એમણે અમને આશીર્વાદ આપતા એવું કીધું હતું કે એમને તમે ડોક્ટર છો, કાંઈ પણ જરૂર હોય તો કોઈ દિવસ ભૂલતા નહીં, અને આ સમાજને તમારી આ સમાજ તમને જેવી રીતે અમને રાખ્યા છે એવી રીતે તમે પણ એમને કરજો. તો એટલું કહેવા માટે જ મેં આ સ્લાઇડ મૂકી હતી. નેક્સ્ટ પ્લીઝ. Next, please. Next.
So it's not moving for some reason.
Oh,
there we go.
So મારા આજે 2 ટોક હું આપીશ, પણ આઈ નો કે ટાઈમ હવે ઓછો છે, પણ જેટલું બને એટલું જલ્દી કવર કરવા ટ્રાય કરીશ. પહેલું છે વોટ ઇઝ કેન્સર અને વોટ કેન કોઝ કેન્સર. આ પહેલી ટોક છે. નેક્સ્ટ પ્લીઝ. સો આપણને જાણે કેન્સર શબ્દ સાંભળીએ એટલે હમણાં કેટલું સરસ ડોક્ટરે કીધું કે આપણને એકદમ ગભરામણ થાય કે હવે આપણે કેન્સર, અને ક્યાં તો ફેમિલીમાં કોઈને થાય તો, અને ડોક્ટરને કે હેલ્થ, આપણે તો આપણા સમાજમાં બી જુદા જુદા ડોક્ટર હોય, જુદા જુદા બીજા હેલ્થ પ્રોફેશનલ હોય, ફાર્માસિસ્ટ હોય, બધાને પૂછવાનું ચાલુ કરી દઈએ કે આ શું કેન્સર એટલે. અને હવેના જમાનામાં તો ઇન્ટરનેટ પર પણ જોવા માંડીએ, જેમ કીધું એમ. નેક્સ્ટ પ્લીઝ. પણ ડોક્ટરને પૂછીએ ત્યારે આ બધું સરસ રીતે સમજાવે, પણ નોર્મલી એવું કહે કે કેન્સર એટલે આપણા જે બોડીના નોર્મલ સેલ્સ હોય એ કંટ્રોલથી નોર્મલી ગ્રોથ થતા હોય. દે સ્ટાર્ટ ગ્રોઈંગ અનકન્ટ્રોલ વે, દે મેક અ લમ્પ ઓર ટ્યુમર. એન્ડ નેક્સ્ટ પ્લીઝ. અને આવા બધા કન્ફ્યુઝિંગ વર્ડ સાંભળીને એ વખતે એક તો કેન્સરની ચિંતા હોય, અને પછી આ સેલ્સ શું, uncontrolled growth is what? What's lump? What's tumor? And this is like my first grandson. He's now 7-year-old. But when at that age, it's so confusing when so many toys comes to him. What is this? What will I do with this? Do I understand anything? So next, please. Next, please. And no. Can you go back, please? And retire થયા પછી આ છેલ્લા મજા આવે કે જ્યારે વિન્ટર હોય, આ વખતે નથી જવાય, પણ વિન્ટર હોય ત્યારે ઇન્ડિયામાં જઈને બી ટોક બહુ બધા કહે છે કે અમને આપો. ત્યાં આવી રીતે આપતી હોઉં તો હવે ગુજરાતીમાં બોલવાની વધારે ટેવ પડવા માંડી છે. નેક્સ્ટ પ્લીઝ. તો કેન્સર એટલે શું, હવે તમને ટૂંકાણમાં સમજાવું છું કે આપણે જ્યારે આવા સરસ મજાના ઘરમાં બેઠા છીએ અને ઘરમાં સરસ મજાના રૂમ છે, બરાબર, સરસ રૂમમાં બેઠા છે, પણ કિચન હશે ને બેડરૂમ ને ડાઇનિંગ રૂમ, અને એવી રીતે આપણે એ જોતા પહેલા હવે આ જોઈએ કે કેન્સરનું સમજવા માટે કે આપણે આવા ઘરમાં વાત કરી એવી રીતે. આ હું શ્રીલંકા ફરવા ગઈ હતી. બૌદ્ધિસ્ટ ઊંચામાં ઊંચો ટેમ્પલ છે, 400 ફીટ, વર્લ્ડનું ઊંચામાં ઊંચું બૌદ્ધિસ્ટ ટેમ્પલ છે આ, અને 400 ફીટ ઊંચું છે, પણ અંદર બહુ સરસ હતું. એવી રીતે આપણે બી સરસ મજાના ઘરમાં બેઠા હોઈએ, જુદા જુદા રૂમમાં, પણ જ્યારે બહારથી એ સરસ મજાનું ગમે તેવું હોય, તાજમહલ હોય કે જે, પણ બહારથી શેનાથી બનેલું હોય? ઈંટોથી. અને એવી રીતે દાખલા તરીકે આમાં આ સરસ મજામાં કેટલી છે? 9 કરોડ ઈંટો છે. નેક્સ્ટ પ્લીઝ. એવી રીતે આપણા શરીરમાં પણ એને ઘર સમજો, શરીરને ઘર સમજો. અને શરીરમાં જુદા જુદા રૂમ છે, લંગ ને બ્રેઇન ને બ્રેસ્ટ ને બધા જુદા જુદા રૂમ છે. અને પણ બહારથી જેમ પેલું આપણું સરસ મજાનું ઘર કે સરસ મજાનો તાજમહલ કે આ હતું, એ શાનું બનેલું હતું? ઈંટોનું. ગમે તેવું હોય પણ ઈંટોનું. એવી રીતે આપણું શરીર પણ બધી વસ્તુમાં, બ્રેસ્ટ હોય કે પછી ઇન્ટેસ્ટિન, લંગ, લીવર, બધામાં, સર્વિક્સ, બધામાં શેનાથી બનેલું છે? સેલ. એને સેલ કે. એટલે સેલ એ ઘરની ઈંટોની માફક સેલ. અને આપણા શરીરમાં કેટલી છે? કરોડોની, અબજો ઈંટો છે. આ ટ્રિલિયન એટલે અબજમાં, એટલી બધી અબજો ઈંટો છે એક એક જણના શરીરમાં. એટલે દરેક વસ્તુ, નાની નાની વસ્તુ એ સેલની બનેલી છે. નેક્સ્ટ પ્લીઝ. નેક્સ્ટ પ્લીઝ. હવે શું થાય કે આપણે મજાનું ઘર, નો, કેન યુ ગો બેક પ્લીઝ, કેન યુ ગો બેક પ્લીઝ. આવું મજાનું ઘર હોય ને પછી ઈંટોનું બનેલું હોય, પણ વરસાદ પડે, સ્નો પડે, એટલે બધું ડેમેજ તો થાય જ ને. અને આવું બધું થોડું થોડું ડેમેજ તો કાયમ થતું જ હોય. તો આપણે શું કરીએ? બિલ્ડરને બોલાવીએ ને રિપેર કરવા ટ્રાય કરીએ. બધી તૂટી ગઈ હોય થોડીક દૂર કરાવીએ અને બીજી નવી બ્રિક્સ મુકાઈએ અને એને રિપેર કરીએ. નેક્સ્ટ પ્લીઝ. એવી રીતે શરીરમાં બી આપણે કન્ટિન્યુઅસલી, જેમ હવે મારી ઉંમર થતી જાય છે એમ સેલ બધા બગડતા જાય, એમ બધા બહાર નીકળતા જાય. અને પણ આવી રીતે કંઈક અલ્સર થઈ ગયું, કે જેમ આમ બતાવે છે ને કે હોજરીમાં અલ્સર, કે પછી દાજી ગયા, કે કંઈક વાગી ગયું શાક સમારતા, તો એ બધા સેલ ડેમેજ થાય. તો કંટ્રોલ રીતે, એટલે શું કે નવા મૂકી દે, કુદરત જ નવા મૂકે, કશું કરવું ના પડે, કુદરત નવા મૂકે. એને કંટ્રોલ ગ્રોથ કહેવાય. પણ નવું મૂકીને જરૂર હોય એટલા કરીને બંધ કરી દે, એને કંટ્રોલ ગ્રોથ. એ વખતે કેન્સર ના થાય. સેલ ગ્રો થાય પણ કેન્સર ના થાય. નેક્સ્ટ પ્લીઝ. નેક્સ્ટ પ્લીઝ. પણ અનકન્ટ્રોલ એટલે શું? નો, પ્લીઝ ગો બેક. આઈ શુડ નોટ સે ટ્વાઇસ, આઈ એમ સોરી.
That's all right.
અનકન્ટ્રોલ ગ્રોથ એટલે કેન્સર, એવું કહે છે. એટલે એમાં શું થાય કે આ બધી નવી ઈંટો મૂકતા હોય પણ કંટ્રોલ જતો રહે. દાખલા તરીકે આપણો નાનું છોકરું હોય ને ટીવી બહુ જોયા કરતું હોય ને કઈ ભાઈ તું ભણવા જા ને જાય નહીં, ને કંટ્રોલ આપણો જતો રહે તો નપાસ થાય. એવી રીતે આમાં કંટ્રોલ જતો રહે અને સેલ આયા જ કરે. એટલે બ્રિક્સ મૂક્યા જ કરો. તો શું થાય કે જૂની જતી ના હોય અને નવી બહુ મૂક્યા જ કરો, બંધ જ ના થાય ને પડી જાય. એ વખતે અનકન્ટ્રોલ ગ્રોથ મીન્સ કેન્સર થયું. નેક્સ્ટ પ્લીઝ. અને એટલે આ હવે મારે આમાં બહુ ડિટેલમાં નથી જો, પણ ઉપર છે એ કંટ્રોલ છે. એટલે આપણને કંઈક બી રેગ્યુલરલી થયા જ કરે અને બધા જે સેલ બગડ્યા હોય, બ્રિક્સ બગડી હોય, જતી રહે સેલ અને નવી એની જગ્યાએ મુકાઈ જાય. એને નોર્મલ. કેન્સરમાં એ બંધ જ ના થાય, ચાલુ ને ચાલુ જ રહ્યા કરે. બધા સેલ ઈંટો મુકાયા જ કરે અને બંધ ના થાય. નેક્સ્ટ પ્લીઝ. અને તો પછી આપણે ડોક્ટર પાસે હમણાં જ આપણને કીધું ટ્યુમર, લંબ, એ બધું શું છે? અને એને સીધી બહુ સરળ શબ્દોમાં સમજાવું તો, આમે જે ઈંટોની વાત કરી ને કે ઈંટો મૂકે, એવી રીતે સેલ મૂકતા હોય તો ફર્સ્ટ, અનફોર્ચ્યુનેટલી મારી પાસે છે નહીં, પણ કેન યુ પોઈન્ટ આઉટ ધ રાઈટ, Kirit, can you point out the left, completely left, when the arrow is, where there is a ear and top of it?
This one here?
Yeah, on top. Go up the arrow, where the arrow is. Yeah. So that bit, yeah. From there to there, what happens કે બધી આ જે સેલ મૂક્યા કરે ને, જે બ્રિક્સ આપણે કહીએ રીતે સેલ મૂક્યા કરે, પણ પછી થોડુંક વધારે, કોઈ વખત સરખી ના મુકાય તો આ કોઈ બિલ્ડર સારો ના હોય તો થોડી આડી અવળી મૂકી દે, પણ બંધ કરી દે. અને તેને શું કહેવાય, આવી રીતે હવે ઊંચું દેખાય ને, આડું અવળું ઊંચું દેખાય તો એને લંપ કહે. પણ લંપ બે જાતના હોય, કેન્સર હોય અથવા તો બિનાઇન એટલે કેન્સર ના હોય. એટલે કિરીટે હમણાં એરો બતાવ્યો ને, એમાં કેન્સર નતું, લંપ થયો છે પણ કેન્સર નથી. કારણ કે થોડી આડી અવળી બ્રેક થઈ પણ આ કાનની પાછળ, પણ પછી બંધ થઈ ગયું. જ્યારે બીજી બાજુ કિરીટ, કેન યુ પુટ ધ એરો નાઉ અધર સાઇડ, વેર ધી, યા, ફ્રોમ ધેર ઓલ ધ વે ડાઉન નાઉ. યા. હવે અહીંયા શું થયું કે બંધ થતું નથી, ચાલુ ને ચાલુ જ રહેશે. જે ઈંટો મૂકવાની, એટલે સેલ મૂકવાના ચાલુ ને ચાલુ છે, એને હવે કેન્સર થવા માંડ્યું. અને એનાથી બી કિરીટ, કેન યુ ગો ડાઉન ધ લાસ્ટ વન ઓન રાઈટ હેન્ડ સાઇડ, યા, ઓલ ધ વે ડાઉન. હવે અહીંયા શું થયું કે એ થયા પછી એટલી બધી ઈંટો આવી ગઈ કે પછી લોહીમાં જવા માંડી. એટલા બધા સેલ આવ્યા, ક્યાંક તો જવું પડે ને, એ લોહીમાં જઈને આખા શરીરમાં પ્રસરી જાય. એને કેન્સર થયું, કેન્સર મેટાસ્ટેસિસ થયું કહેવાય. કેન્સર એ જગ્યાએ અને એટલે ઇમ્પોર્ટન્ટ કે જ્યારે હજી શરૂઆત જ થતું હોય ત્યારે સ્ક્રીનિંગ થી પકડી શકીએ ને તો એ વખતે આપણે ટ્રીટમેન્ટ થઈ શકે અને બધું સારું થઈ શકે. નેક્સ્ટ પ્લીઝ. સો ઇટ વોઝ શોઈંગ ધ ડિફરન્સ કે આ ટ્યુમર એટલે શું, બિનાઇન, મેલિગ્નન્ટ, અને આ બાજુ બિનાઇન છે કારણ કે કંટ્રોલ ગ્રોથ છે, હજી થોડી આડી વળી મૂકાઈ ગઈ છે, અને બીજી બાજુ અનકંટ્રોલ છે એટલે ચાલુ ને ચાલુ જ રહેશે અને કેન્સર થાય છે. નેક્સ્ટ પ્લીઝ. અને એના કોઝ શું, બધા બહુ કોઝ છે, જુદા જુદા કેન્સરના જુદા જુદા કોઝ હોય છે, પણ આમાંથી એજ, ઓબેસિટી, જીનેટિક્સ કોમન બધે છે. પણ નેક્સ્ટ વન ટબાકો ચ્યુઇંગ, અને એ આપણા સાઉથ એશિયનમાં એટલું બધું છે કે હું ઇન્ડિયા જઉં ને જોઉં છું કે ઓરલ કેન્સર નાનાથી માંડીને મોટાના પુષ્કળ છે, ગુટકા પાન, બીટલ નટ ને ટબાકો ચ્યુઇંગને લીધે. અને બીજું બધું જે છે બાકીના બધા કે હેવી આલ્કોહોલ યુઝ કે પછી હ્યુમન પેપિલોમા ને વીક ઇમ્યુન તો અત્યારે તમે બહુ સાંભળો છો કોવિડને લીધે. પણ નેક્સ્ટ વન આઈલ એક્સપ્લેન લેટર ઓન. નેક્સ્ટ પ્લીઝ. સો કેન્સર ઇઝ નોટ કેન્સર. અને આપણે હવે હું ત્યાં ઇન્ડિયામાં બી લેક્ચર આપવા જાઉં તો પહેલું એ મૂકું કે કેન્સર ઇઝ નોટ કેન્સર. દેર આર હોપફુલ ફેક્ટ્સ અબાઉટ કેન્સર. અને હવે આપણને ખબર પડી કે શરૂઆત થતી હોય એટલે શું, અને એ વખતે જો સ્ક્રીનિંગ કરીને પકડી શકીએ કેન્સરને તો મોટા ભાગનાને તમે પ્રિવેન્ટિવ ઇટ મીન્સ કે આપણે સારા બી થઈ શકીએ છીએ અને કેન્સર એ ટાઈમે તો જતું બી રહી શકે છે. નેક્સ્ટ પ્લીઝ. સો અત્યારે હવે તમને કહેતી નથી કે કેન્સર માટેના સવાલો પૂછો, કારણ કે જે રીતે શરૂઆતમાં કીધું હતું ને એ પ્રમાણે કે સવાલો પૂછવાના બદલે હવે તમે ચેટમાં મૂકજો સવાલ, અને પછી આપણે પાછળથી પૂછવાના રહેશે. ઇઝ ધેટ રાઈટ?
Yeah. Got the second thought.
Yeah, I think what આપણો 10 past 6 થઈ ગયા છે, એટલે
Okay.
I think we will take some questions and answers now.
Okay.
And
Topics we may want to later
people,
on.
માણસોને છે ને થોડોક સમય આપીએ કે આપણે ક્વેશ્ચન આન્સર્સ માટે.
Sure.
અને આપણું નેક્સ્ટ ઇવેન્ટ છે એ આપણે દર મહિને અમે એઝ અ કાન્સર ચેમ્પિયન્સ એવી રીતના નક્કી કરતા હતા કે વી વિલ એકચ્યુઅલી do a presentation or we'll do a event every month. પણ કોઈને કંઈ question હોય તો or anything, if anyone wants to ask, can you put your hand up or put your question in the chat? The first question.
Mother Auntie, we've got, I don't know if you can see it, Bharati's iPad. I think they
Bharati's
want to,
iPad.
Yeah. Can we unmute them and get Bharti Ben Lokane? Bharti Ben?
Thank you very much for nice presentations. So I would like to ask maybe combined question to Dr. Divya as well as Meenakshi Ben. I think we also got this angelic Parvez experience. Now, as few of you might remember that my daughter, who is sitting next to me, she has gone through a very sorrowful state back in 2020, early part or later 2019, she started having symptoms. Now, I must say the COVID has made the whole matter worse in all aspects, which I'll explain to you in a minute. Now, so Millie, her name is Millie, I'm Rajesh, and my wife is Bharati. So Millie has had a problem passing the toilet for a number of months. We thought it might be indigestion, it might be something else, didn't take it that seriously. Now, so I'm trying to, because of the lack of time, I'm going to go to the points by saying the colonoscopy was supposed to be done in March 2020. Instead, it was delayed till July the 8th, 2020. And that highlighted that she has had a bowel cancer. Now, a doctor was extremely apologetic few times and said, I'm sorry, we have delayed your appointment, this colonoscopy, blah, blah, all that. Now, saving that, and then the Midden's hospital was supposed to do the operation, but they didn't do it because the Millie has got an underlying heart condition, and that made her to, they transferred all the files to MRI because they had a specialist anesthetist who knows about her conditions of the heart and things. So they did that on 29th of September. She had a bowel cancer removed. Now, with God's blessings, everybody, all the well-wishers' blessings, it was not malignant, like Meenakshi Ben samjhayu.
No, malignant.
Mali-
It is a malignant.
Huh?
It is malignant.
Yeah, we
Not
didn't spell.
benign.
No, yeah.
No,
sorry.
it is a malignant cancer.
Okay. Yeah, so it was restricting the passage in Millie's case to the level that she, instead of going once a day or maybe twice a day, she used to go to toilet 8-9 times a day. So that can clearly tells you. So anyways, that cancer was, all of it was removed by Professor Hill, and he then said also he took 21 biopsies surrounding areas, which was then sent for whether the cancer is spreading or has spread or not. And very fortunately, with God's blessing, it was all clear from the cancer cells. And then she...
સોરી રાજેશભાઈ,
Yeah,
તમે છે ને તમારો ક્વેશ્ચન કયો કે તમારો ક્વેશ્ચન
yeah.
શું
The
છે?
question now, sorry, it comes to, we don't know what has caused bowel cancer to Millie. Now, regarding the breaks, regarding the cells, I can understand that it's probably caused that lump, that caused that tumor. But still, she's only 40, and why did it happen to Millie? And what can be the cause? Can somebody comment on that, please?
I think Divya, before you answer, I think આજે અમે બાઉલ કેન્સરના symptoms ની વાત કરવાના હતા. But I think we're going to postpone that bowel cancer presentation for the future event, where we can actually just talk about bowel cancer on its own.
That's fine, that's fine.
પણ હું તો અવોઇડ નથી કરતી તમારો ક્વેશ્ચન, પણ before I'm just making it easier, કારણ કે એ આખો સબ્જેક્ટ જ એકદમ જુદો છે. અને Divya will and Meenakshi Ben will be able to give more information, પણ હું તમને ખાલી જાણ ખાતર કહું છું કે આપણે આખો
No, that's fine. I can understand the limitation of time. So we'll wait, and I rather have a properly explained situation rather than just a couple of sentences.
Are you happy with that, Rajesh bhai?
Yes, absolutely, absolutely.
Okay, thank you.
You don't need to ask that.
So please keep coming to our event, because bowel cancer amara part of our plan che.
Yes, it's the number 2 item on the
that's what we will focus on. It will take that your message on board. So I just want to thank Meenakshi Ben. What a brilliant presentation that was. કેટલું સરસ આપણને ગુજરાતીમાં સમજાવ્યું તમે. આખું હું વિચાર કરતી હતી બ્રેસ્ટનું પ્રેઝન્ટેશન. હાઉ એમ આઈ ગોઈંગ ટુ, હું ગુજરાતીમાં શું બોલી શકવાની, કેવી રીતના, પણ તમે કેટલું સરળતાથી સેલ શું છે, ટ્યુમર શું છે, એનું પ્રેઝન્ટેશન શું છે, કેવી રીતના દેખાય છે, એવી રીતના તમે સમજાવ્યું. સો રિયલી અપ્રિશિએટ ધેટ. સો બીજા કોઈના કંઈ રેલેવન્ટ આ લોકોના જે પ્રેઝન્ટેશન હતા એના એક રેલેવન્ટ ક્વેશ્ચન્સ છે? Has anybody else got any questions that were relevant to the presentations?
Carry on.
Sorry.
There was one question I noticed, Madhuben. Somebody asked Angelique whether the treatment helped her or not.
Angelique?
Hi. Sorry. Mother Auntie, if I could just answer. So unfortunately, Angelique wasn't able to stay for the rest of the presentation, but yes, she received therapy for bilateral cancer. So she had cancer in both breasts, and she had therapy, and she has made a recovery.
Thank you.
Can I make one comment?
Yes.
Can do.
This bowel cancer, you are quite right કે આપણે next વખતે કરીશું ત્યારે પણ એમને જે confusion થયું ને કે metastasis અરે પેલું કેન્સર નતું કે મારી સ્લાઇડ જોઈને અને એમના વાઈફે કીધું કે ના કેન્સર હતું. હવે મને ખ્યાલ આવે છે કે તમને શું કન્ફ્યુઝન થયું કે એ જે અનકન્ટ્રોલ ગ્રોથ સેલ ઉપર ને ઉપર નાખ્યા જ કરે એ ઉપર ને ઉપર નાખેલા એની એ જગ્યાએ હોય તો એને મેલિગ્નન્ટ તો કહેવાય. પણ પછી જો શું થયું કે એને બીજા બધા હું મારો પ્રોફેશન પેથોલોજી હિસ્ટોપેથોલોજી એટલે આ બાયોપ્સી બધી અમારી પાસે આવે ને અમે માઇક્રોસ્કોપમાં જોતા હતા. એનીવે પણ એટલે જ્યારે બહુ પછી વધારે થાય ત્યાં જગ્યા ના રહે ને પછી બીજે દૂર જાય પછી બ્લડમાં જાય લિમ્ફેટિકમાં જાય એને મેટાસિસિસ કહેવાય. એટલે તમારા કેસમાં તમને જે કન્ફ્યુઝન થયું ને એ મેલિગ્નન્ટ હતું પણ એ જ જગ્યાએ પણ એ પ્રસરેલું નતું એમ કહેવાય. એ બિનાઇન લમ્પ નતો કારણ કે બિનાઇનમાં તો થોડુંક થાય પણ બંધ થઈ જાય. આમાં ચાલુ રહ્યું એ વખતે. ઓકે.
Thank you, Mercy.
Thank you so much.
Thank you.
That was very helpful, Meenakshi Ben, for Rajesh Bhai ne response આપવા માટે. So that's appreciated. બીજા કોઈને કાંઈ questions છે? So what we wanted to do was we need your Parvati Ben, તમારે શું કંઈ વાત કરવી છે?
Yes, I did. I know that we only discussed about lung cancer and bowel cancer this time, but I actually suffer from pancreatic cancer.
Right.
Is this particular cancer going to be covered in your next forthcoming events?
પાર્વતીબેન અમે આપણે સાથે કામ કરવાનું છે. We are only just started our answer cancer no એટલે you know whatever the community requires આપણે સાથે ભળીને સાથે એકબીજાની સાથે લર્ન કરવાનું છે. So of course if તમને pancreatic વસ્તુની જાણ જોતી હોય તો these are suggestions that અમને જોઈએ છે કે આપણે હવે ભવિષ્યમાં આપણે કેવી રીતના સાથે મળીને કરી શકીએ. એટલે those are suggestions we need. એટલે for that reason આપણે જે answer cancer અમે champions જેટલા ભેગા થયા છે we're only facilitating અને you know we've got આપણી communityમાં people just volunteering. I mean Divya just volunteered. So we've got a lot of, we are so skilled in our community, we'll be able to get lot more Divyas and lot more Angeliques. So
Yes.
and Parvati Ben, you know, thank you for coming forward with your question. So
No problem. No problem. I'm basically somebody actually sent this. In fact, it was my sister-in-law. She's a psychologist and a professional in medical fields. She works in Watford. She lives there as well, and she's the one who sent me your information and link to you know, because I was a bit anxious. I'm undergoing a second chemo. After I had my first one, which was successful, radiotherapy was successful, everything seemed to be going fine, and then suddenly, you know, new markings, and that has obviously made me quite ill. So second, I'm being given the FOLFOX chemotherapy session, which has made me quite ill. It's taken a lot out of me.
Mhm.
But because I was anxious, she said, just listen into it, Bhabhi, and તમને જરાક કંઈક પણ એમાંથી મળશે ને, તમને આમ શાંતિ મળશે, તમને બધાની વાતો સાંભળશો તો તમને જાણવા મળશે. And it has helped me a lot. જે મીનાક્ષીબેને બધું કીધું, ગુજરાતીમાં સમજાવ્યું, એ બધું બહુ સારું હતું, બધું આમ સમજપૂર્વક હતું. And I've been through that stage as well. So, but what Angelica mentioned about the, and came forward and said is something that I would like to someday say as well, and make people aware, કે ડરી નહીં જવાનું. You stay positive. ડરવાનું નહીં. It's anything like any તમને disease થાય, બીમારી થાય તો તમે ગમે ત્યારે, સામનો કરવાનો જ. તો, it's like you have to fight things. And that is what we are doing, fighting cancer. So hopefully, future ma, once I get well, haji mari thodi treatment baki che, and I will be able to speak to everyone openly. I can't be presentable at the moment. I'm not presentable at the moment.
Very good.
It's
Yeah,
perfectly,
That's,
yeah.
That's very good, Parvati Ben. I was wondering if you could just leave your contact details with us. We will try and contact you.
Sure. Yes, and please do send me things as well. My phone number, if anybody is interested. I don't know.
તમે chatમાં either privately, if you're happy sharing with everyone, તો chatમાં તમારો contact details મૂકી દ્યો, પાર્વતીબેન.
Yes, I'll put it for Dinesh Bhai.
Yes,
Ah,
please. Yeah.
That'll be lovely.
Okay, thank you very much for the
Thank
information.
you.
Thank you,
Thank you.
Parvati Ben.
Thank you,
Thank you.
doctor.
Thank you.
Thank
As
you.
well.
Thank you.
Thank you.
Can I make one point on the question which Ben asked?
Yes.
Is that okay? The one point is કે આપણે જે ત્રણ કેન્સરની વાત કરીએ છીએ ને, બ્રેસ્ટ, સર્વિક્સ ને કોલોન, એ ત્રણે માટે સ્ક્રીનિંગ પ્રોગ્રામ છે. અને એટલે એ અમે એટલે કવર કરવાના હતા કે અમે ઘણું કામ કર્યું છે એના માટે ને જોયું છે કે આપણા લોકો જતા નથી એ સ્ક્રીનિંગ માટે. એટલે એને તો કવર કરવા જ છે અમારે. અને આવી રીતે આમ સો ગ્લેડ કે પોતાને છે તે છતાં બી એમણે સામે ચાલીને કીધું કે આ શું છે. આપણામાં લોકોએ બોલતા નથી. હવે આવી રીતે કીધું આ તો આપણે એનો ચોક્કસ કરવું જોઈએ. અને તમે કીધું જ કે આપણે એનો કરવા ટ્રાય કરીશું. પણ વધારામાં આ ત્રણ એટલા માટે ખાસ કવર કરવા છે કે આ દેશમાં NHS ફ્રી સ્ક્રીનિંગ પ્રોગ્રામ આપે છે અને અમે કામ કર્યું છે પ્રમાણે આપણા લોકો જતા નથી સ્ક્રીનિંગ માટે.
Yeah.
Okay.
Yeah,
So
સાચી
this
વાત
is
છે.
this is the main reason why we've got this forum going and support group going. Okay. આપણા હિન્દુ માણસો, ઇન્ડિયન માણસો આગળ આવી શકે અને એના પ્રોબ્લેમ્સ જે હોય ડિસ્કસ કરી શકે અને ઠોક કરી શકે આપણી સાથે. That's the main reason for this forum.
Thank you, Dinesh Bhai. I think, Madhubhai, I think we should try to wrap up if I can.
Yeah.
Can I just say thank you, first of all, to Dr. Divya Rajani, to Angelique Parvez, to yourself, Dinesh Bhai, to Madhu, to Krishna Ben and Saroj Bhai. I think if I missed anybody out, I think Madhu Ben, I think last of all.
Meenakshi-ben.
And Meenakshi-ben, of course, sorry. Meenakshi must say to me. Meenakshi must say to me. Can I say thank you for everyone for taking part, and also for recognizing that this is a very difficult subject, but also recognize that there's a lot of work we can do together. This forum is a first step. By all means, please leave your details behind in private chat so that we have your details so we can contact you. It's very hard to get information out if we don't know who you are and where you are. But that's definitely something we need from yourself today. Give us any feedback as well about what could be improved, what we could learn from. We recognize that we had a very action-packed agenda for today. But we were thinking we were ambitious. But we will try to do better next time to make sure that everybody who for the information that we need to get across. Have I missed anything out? I think just to bear in mind, Answer Cancer is a Greater Manchester-wide program, but the NHS screening programs are obviously national and nationwide. So wherever you are, please do look at your bodies. Anything that's not normal for you, go to your GP, as Dr. Divya said. Come forward, don't be shy, don't be embarrassed. That's the first point. Early treatment means that you are more likely to have early your survival chances become better, and therefore, and screening programs are there and they're free. So if those three messages need to be taken away from you today, if you can, and share that with everybody else. Everything that we're trying to do is to break down those taboos and to have a conversation with your families. And this is a difficult subject, but we can make it not difficult, as Dr. Sai said earlier, and Dr. Jani said as well. So I'll stop there. Have I missed anything else, Madhuben?
I don't. I think that's. We just need to give people our contact details.
Yeah, I'll put the
So
chat.
if people want to contact us.
Okay, I'll put it in the chat now.
Okay. So that will be કોઈને feedback આપવી હોય કે કોઈને suggestions હોય કે this you want to actually bring something up, then please put your please come back to us. અમૃતભાઈ ને કંઈ કેવું છે ને?
Madhuben, can we have Dr. Divya again for this kind of presentation?
Dr. Divya?
Yeah.
I'm sure we can persuade Dr. Divya Rajani. I think I pinned her down anyway. I said કે આપણે ગુજરાતીમાં કરવાના છે તો દિવ્યાનું presentation આખું જોશે, આખો event કરવાનો છે એના માટે.
Okay, that's very good.
Yeah, I mean, again, I really apologize anybody that couldn't understand because of the English, but hopefully if we can try and get some help with the translation. Obviously I'm Gujarati, but my Gujarati would not be good enough for this. So yeah, I'd be more than happy to do, if you could send your suggestions to us. And I'm sure the team, Kirit uncle, Dinesh uncle, Madhu auntie, and Meenakshi auntie as well, who's done such a good presentation in Gujarati, which I could understand perfectly. If they could help with the language, then definitely we would.
I think what's happening now is everybody coming forward. I lost my wife 14 years through the cancer. And that time she was bullied by GP not to complain to the other go. And when I asked for second opinion, she was told that if your husband go and ask for second opinion, I'll struck you off my list. And that was another thing. 17 years ago.
Yeah.
People was bullied by GP.
Yeah, so that culture, we're trying to break that culture.
Yeah.
So, and the only way we can do that is by empowering patients. So if you get the information and you know that you have rights to things, second opinion, certainly. So that's the purpose of this, really, to help educate you all. So
also, I would like to say to our people, especially, join your PPG group, that's your doctor services.
Yeah.
Then you get to know what they're doing and you can ask them a question.
Yes. So
I'm part of PPG.
Yeah.
In Duckenfield, because so many people, there's only one of us there, no one else. Not a single Asian.
Yeah.
I think, sorry, just to add, I think there are a number of ways that people can start looking at how the health services are there for us, and equally we have to take ownership of our responsibility. It won't change without us taking a step and asking those questions. I thank you, Amrit, for asking and saying, presenting what the issues and barriers are. But part of our program is to recognize what we can do to challenge and change for the better. Okay, so I think we should.
So going back to the Amaro contact details, just emphasizing that ame answer cancer na champions che. There's 6 of us. There's Meenakshi Ben ne tame joya. Manchester na ne Jain Samaj na answer cancer champion che. We've got Dinesh Bhai and Amrut Bhai, who embrace this program really well, and Eloka Sri Bharti Mandir na answer cancer champion che. Pachi apne Oldham na we've got Suraj Ben and we've got Krishna Ben, who've done some work already. So Eloka tya answer cancer na champion che. And I'm joining the whole group of Manchester, but currently I'm working with Sri Bharti Mandir and Indian Association Oldham. સો અત્યારના હું બંને સાથે શરૂ જ કર્યું છે મેં અને દિનેશભાઈએ સાથે જ શરૂ કર્યું હતું આન્સર કાન્સરનું. સો તમારે કોઈને અમારી સાથે ગમે તે નાનકડું પણ ગમે તેવું કામ કરવું હોય તો પ્લીઝ કમ ફોરવર્ડ અને આપણે સાથે મળીને લેટ્સ બીટ કેન્સર.
Okay, that's very
Excellent.
good.
Thank you. Thanks, everyone. Can I say
Thanks,
thank
everyone.
you thanks for coming along and enjoy your evening. Namaste. Is that
Thank
my-
you very
my
much.
Gujarati?
Everybody,
Namaste.
thank you.
Namaste,
Thank
everyone.
you so much for
Namaste.
attending. Really, really grateful to you all. Namaste.
Namaste.
Yeah,
good
thank
day.
you.
Thanks.
આપણે પાછા
Bye.
બેસું આન્સર કેન્સરના ચેમ્પિયન્સ.
Look forward to hearing from you.
Thank you, Parvati Ben, for sharing.
Thank you all. Thank you all.
Thank you.
So many thanks.
Thank you.
Namaste. Thank you, everybody.